After learning how different types of skin are there, we need to identify the skin type. So how do we identify the skin type? Just by looking into it? Yes, but there are ways of identifying it, and there are some parameters. So you can identify a skin under a normal light, a natural light, or with a magnifying light, also with wood lamps. But see that the face is clean and free of makeup, and then examine the skin. Keep a note to keep your findings, remember, and recheck from time to time to see if there is alterations, again due to different season, aging, or hormonal changes, or by stress. So let's see how the skin looks and how it behaves according to the skin type. So the normal skin usually has an even texture, it has a minimal lines. There's no shine, but it is lively and has a bright tone. It looks translucent. It is mostly trouble free, it will feel supple, it doesn't have any spots or blemishes. Unlike to that, a dry skin will have a fine texture, will have light fine lines or dryness and fleckiness. It looks good when it is young and nothing upsets it, but the skin looks stretched. It looks as if later on it looks like it's flecking and blotching. It gets irritated faster. It behaves badly in winter, so it's dry in winter. The sweat glands are not working, not active, so it gets dry, it starts flaking. It can't get enough moisturizer, so you need to reapply moisturizer every now and then to keep it supple and prevent it from blemishes. A sensitive and a dehydrated skin. We have heard people saying, मेरी skin बहुत sensitive है. I have a very sensitive skin. So now what sensitive skin is actually? It is very thin. It looks stretched. So there is irritation on slightest change in weather or any different products used. There might be no lines around, but then there are few lines around the mouth, eyes if you get older. It has a very fine texture. It is very terrible on touch. It might feel irritable or sensitive. It looks taut and papery to touch. Very fine it is. Very thin. And gets red on very slightest application of products or by the change of climate. On contrast to all this is the oily skin, which has a very coarse texture. It might have open pores. It is very shiny. It looks dull. It can have blemishes and pigmentation. It will be very resilient. It will soak up all the cosmetics, particularly in warm weather. It looks oily, very grumpy. It takes the makeup, but looks oily. And it is more prone to blemishes and acne. So let's see what all problems oily skin can face. Melia, pimples, seborrhea, cysts, acne scars, acne, and pigmentation, sun damage, photosensitivity. These all problems can be faced by oily skin. So let's see in brief what each condition is. Melia or whiteheads. You have heard about whiteheads on your nose or on your chin. So these are small sebaceous gland causing accumulation of dead and keratinized cells and sebaceous matter which is trapped beneath the skin. Mostly it is on your nose, your chin, but it can even occur on your chest, shoulders and back. These look like very small grains of sand under your skin, white grains. If you don't flush it properly, or remove this white milia or whiteheads immediately, the dead cells pile up and it can even look as blackheads. So milia are just small grains under your skin, whereas pimples, these are bigger. This is the beginning of a pimple is after these milia swell up, or if a follicle becomes filled with oil, dead cells, and the bacteria infiltrate. It swells up and the ruptures the debris which escape into the dermis. Dermis gets irritated and it causes an inflammation. Now the white blood cells rush into and fight against the bacteria. This creates the pus. And this is the beginning of a pimple, which appears as an inflamed red or blue red lump. When the overloaded follicle ruptures over the surface of the skin, it is not serious and it will usually heal rapidly, leaving no permanent mark. However, if the follicle breaks beneath the layer of the skin, it is more severe and takes longer time to heal, leaving permanent scars. So you see small scars when the follicles are deep. So it's better you go get a cleanup done by a dermatologist. So there are no scars when you have such type of pimples. When the pimples are also pinched or squeezed, the infection material comes out and it spreads to the surrounding tissue because it has bacteria. This again goes, spreads, and it causes inflammation to the other pimples on the person's skin. Acne usually doesn't. Acne is very common, but it does not spread from one person to another, so it's not a contagious disease. If proper treatment is not taken, acne might cause even permanent scarring. Seborrhea is another condition of an oily skin. This is due to the overactivity and excessive secretion of the sebaceous gland. As we know, sebaceous, oil glands, and sweat glands are in the dermis layer. Now, sebum is an oily or shiny condition of the nose, forehead, scalp that indicates the presence of seborrhea. It is readily detected on the scalp by the unusual amount of oil in the hair. So, when you wash your hair after 2 days, you feel your hair is not as dry but has turned oily. That is due to the secretion of oil from the seborrheic glands. But excessive secretion will cause seborrhea. Seborrhea is often also the basis of an acneic condition. Now the cyst. Cyst appears as a large, hard and painful lump beneath the surface of the skin. A cyst is a severe pimple that takes a longer time to reach to the surface of the skin. As the cyst finds its way to the surface, it may kill many live cells and will leave a permanent scar, which is also known as acne pits. Now, the acne scars are different types, which we'll learn further. So, this is an acne pit. In pimples, you might find acne scars. Quite often, a wall membrane will form along the debris and medical treatment may be needed to clear the condition. Acne scars. Now, as I said, acne scars are of different types. Now, there are 3 types predominantly, which are ice pick type of acne pits and raised scars. During the formation of acne, if you don't take a proper treatment and care of the skin to prevent acne, this negligence will lead to production of scars. So acne should not be taken lightly, and if it is severe, you have to show to a dermatologist or a cosmetologist and get it treated to prevent formation of the scars. So the ice pick scars, this is one variety of the scar, which are large, visible open pores that look as if the skin has been jabbed with an ice pick or other sharp, thin instrument. It is just a pointed small hole in the skin, as if made by a pin or sharp instrument. The follicle pore always look open, as if a small hole has been made in the skin. The condition is caused by deep pimple or a cyst that has destroyed the follicle as the infection worked its way towards the surface of the skin. Now is the acne pit scars. These are indented and are due to pimples or cysts that have destroyed the skin and form the scar tissue. The scar has slightly sunken or depressed appearance on the skin surface. When several large cysts have clumped together and scar tissue forms, a lumpy mass or a raised tissue is created on the surface of the skin also. These also are raised scars. Acne scars are always not as pits in the skin, but there are sometimes these are also seen as raised scars. So we have seen two different types of acne scars. Now further, to go into cosmetic treatments and treating cosmetic treatments of the skin, we have to have understanding to pigmentation. Pigmentation can be lightening of the skin or the darkening of the skin. It is not the normal color of the skin. So it is either hyperpigmentation or hypopigmentation. Both looks out of the place. It doesn't look cosmetically good. So what is hypopigmentation? Now, melanocytes impart color to the skin, normal color to the skin, that we have learnt. Now melanocytes, if they are destructed, then it doesn't give the normal color to the skin. There is hypopigmentation. So the melanocytes are not there, so the skin color is white or it is lighter. This is due to the destruction of melanocytes. Vice versa, or in opposed to this, is the hyperpigmentation. When there is excessive production of melanin, this also results in uneven skin tones. Now this hyperpigmentation can be formed due to sun exposure or heat or hormones or friction. So whenever there is friction, it causes irritation to the layer and the melanin is increased. Again, there are reasons of hyperpigmentation. Now this could be due to external physical factors which we saw just now, and due to internal problems of hormones which can be melasma types. Melasma is due to hormonal imbalance, and this is a permanent conditions which can be very rarely satisfactorily treated. Now lighter pigments appear, the deeper it is, the longer it will take to get treated. Now liver spots, age spots are much easier to treat. Sun damages are easily to treat. Sun damage doesn't appear in a day or two. It might take years to appear, but it can be easily treated and responds well to the treatment. Post-inflammatory hyperpigmentations are light in color, and are deep in the dermis. They take time to heal. They get darker sometimes as it gets lifted. Photosensitivity is another problem for medicines and perfumes and chemicals, which causes darkening of the skin. If you directly use perfumes or deodorants on your skin, that causes irritation to the skin and causes hyperpigmentation. Any chemical application to the skin might irritate the skin and again causes hyperpigmentation. Solar lentigo, which is sunspots. Due to the exposure of sun, certain areas in the skin causes more production of melanin in certain areas. So certain spot may be more darker than the rest. Freckles, they also appear due to the exposure of the sun. We have learnt about rosacea during our college days. So rosacea or acne rosacea, it is a chronic inflammatory congestion of the cheeks and nose. It is characteristic by redness and dilatation of blood vessels and the formation of papules and pustules. Cause is unknown. So in rosacea, remember, you do not have pus. It is only papules and pustules. So that is a differential factor between rosacea and acne. Signs of rosacea, what all we see in rosacea is the red face, like flushing face, which we say. There is a bit of swelling, acne, burning sensation is there. There is inflammation and dryness. So as we say, it is blushing complexion. It is present on both the cheeks. It is light pink to red in color. Things that aggravate rosacea in individuals can be consumption of hot liquids, spicy food, alcohol, exposure to extreme heat and cold, exposure to more sunlight. There can be stress, anger, embarrassment, and certain types of drugs. There are no whiteheads or blackheads seen in rosacea. As I said, there are no blackheads and whiteheads. I said there's no pus. But they may sometimes develop acne also. Rosacea may sometimes develop acne also. So let's take a lunch break. After lunch, we'll get an hands-on. I'll explain you what types of machines we have and how we treat each pigmentation